say that people don't care how much you know until they know how much you care. And this is especially true in nursing. So I'm going through a new employee orientation for a new job that I just took, and we watched a video about what does a patient consider meaningful in the course of their care. And the woman said something that really stuck to me. She said, he was serving our needs and not just doing his job. And I thought, this is the next level for our new grad nurses. The next level is going from doing their job to really teaching them how to serve. So here are 5 ways to tell if you're just doing your job or if you're actually serving your patient's needs in a meaningful way that creates connection and a lasting impact on a life. Number 1, you are outcome focused versus task focused. And this is really, really difficult because this day and age and nursing the way it is set up is very task driven. It's very checklist driven. It's very protocol driven. And it can be easy to say, I completed the to-do list. I gave my meds. I did my charting. I took my vital signs. I did my reassessments. Check, 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 check. But if you're truly serving the patient, you connect the task to the impact. You ask yourself questions like, did this medication actually help reduce their pain or their anxiety? How do they feel? Have I reassessed their experience? Not just check the box of pain went from 10 to a 4, right? So outcome focus versus task focus. This is the next level of thinking when you're feeling more comfortable with your tasks. Number 2 is you talk with the patient instead of to the patient. There's a big difference in giving instructions or performing assessments in a very robotic, task-driven way without a lot of engagement. But when you're serving the patient in those tasks, you're actually building rapport, you're inviting them into their care, and you're listening for what they aren't saying because patients are scared. We are literally caring for them in the most vulnerable, most challenging, most anxiety-producing moments of their lives. And they are afraid and they are going to be scared to be more vulnerable with you. But when you're building rapport and you're inviting them into those care rather than just giving them instruction and not really engaging when you do the assessment, you're going to be able to hear what they aren't saying. And you're going to be able to address those underlying fears and anxieties. Number 3, you're thinking critically instead of just sticking with the routine. So just sticking the routine, just doing the job means that you get the order, you follow the order, you perform the order, right? Without a lot of critical thinking or engagement or why behind what you're doing. Whereas when you're serving the patient, you're truly taking a breath, you're pausing, you're reassessing, you're advocating for them when the routines and the checklists don't match the unique need of the patient in front of you. So I have a great example for this one. I was working with a new grad nurse and we had a patient, we were in the ER, and the patient didn't want us to check his blood pressure. He didn't want us to draw his labs. The only thing he wanted us to do was give him his freaking pain medication. He was very insistent that until he got his pain medication, he was not cooperating with anything else. And it would be easy to get upset and be like, look, you came here for us to give you care. This is the care I need to give you because this is the routine in which I give care as a nurse. Versus pausing for a minute and I just sat down on the side of his bed with him and I said, I understand that your pain medication is incredibly important. And I promise you, I'm working as quickly as I can to get it. And here's what has to happen in order for me to even be able to get it from the machine to give it to you. The doctor has to order it, which he hasn't done yet. The pharmacist has to verify it, which can't happen until the doctor orders it. And then once it's verified, I can go and remove it for you. But that process on a good day takes about 10 minutes, at least 10 minutes. And that's on a really good day. And oftentimes it takes longer than that. But I hear that that's important to you. So I'm going to work to get that process working as quickly for you as possible. And in the meantime, it helps me to draw your labs and it helps me to get your blood pressure so that I know what's going on with your blood work. And if there's anything that's causing your pain in your blood work that we can fix outside of pain medication, I would love to be able to do that for you. And checking your vital signs is really important for me as a nurse because some of the medications that I give you can cause you to have low blood pressure or can cause problems with your heart if I don't know what I'm doing before I give those. And not only do I want to give you your pain medicine and help you be more comfortable, but I also want to be really safe when I do it. So while we're waiting, would it be okay if I checked your blood pressure and drew your labs? And what I focused on was the fact that I understood that his pain, treating his pain, was the most important thing to him in that moment. And when I could stay focused on what he needed, it was easier for me to align the care that I needed to do with what he was needing, his unique needs, his unique perceptions. And it would have been easy to say, like, oh, he's just drug seeking, forget this, right? And get really frustrated. But that's not true. When you're serving your patient, you're hearing what they aren't saying. You're matching your care to their needs. You're matching your routines to the uniqueness of the patient in front of you, and you're being flexible when you need to. Okay. Number 4, you're prioritizing the human over the chart. Now, I know that charting is a big deal and that you have to document everything that you do. Otherwise, it didn't happen. And my challenge to you is to time yourself with your charting and start making a game out of beating yourself. Like, how quickly can you get your assessment done? How quickly can you chart those vital signs? How quickly can you document those medications? Because those are tasks that do not make a difference for the patient. They're all about reimbursement. They're all about covering your patootie. They're all about documenting the care and telling a story of what you've done. But none of those things actually serves the patient or makes a difference for the patient. So if you're crushing your charting game, but you're missing subtle signs of emotional distress, or you're not taking time to hear what they aren't saying, to like feel that emotion from them, if you're too busy focusing on the chart and you're forgetting about being fully present and making eye contact and being emotionally available as part of that routine, as part of that care, then you're missing the point. Most of us get into nursing to make a difference, and being task focused and talking to the patient and just sticking to the checklist and the routine and focusing on the chart are not what's going to make a difference for our patients. They're absolutely not. They're tools that help us do our job easier, but at the end of the day, they do not directly serve a patient or make the impact you're wanting to make. Last but not least, number 5, you measure your success by speed rather than safety and connection. Now, this one is also very difficult because these days in healthcare, everything is metrics driven. I've even heard of some facilities that have little GPS trackers on their nurses that tell how long they're in a room and how long they're in the med room and how long it takes them to do this task or that task. And that to me feels very micromanaging because they're wanting to break down those metrics of our care for an overall number, and it does not account for connection and for safety, for the things that actually make a huge impact in the patient's stay cannot be measured in minutes. Okay. They are measured in moments. And when you reflect on whether or not your patient felt seen, did they feel heard? Did they feel cared for? Did they feel served? And were you safer because you showed up fully present rather than worrying about how quickly you're getting these tasks done? You, my friend, have made it to that next level of nursing. That's a next level nurse. That's a nurse who does their job well and serves their patients extraordinarily. And I want you to walk away from your job feeling like you did a great job, feeling like you made a connection, feeling like you advocated for your patient. I don't want you going home feeling proud of yourself for just checking boxes. because you got into nursing to do more than just tasks and to check boxes. You got into nursing to make a genuine difference. So these are 5 ways of how you can take your level from just doing your job to truly serving your patient. Much love.